Good morning. Today I will be talking about a leg length discrepancy, or when one leg is shorter than the other. I'll talk about why that happens and what you do about it if it happens. There are two types of leg length discrepancies. One is structural and the other is functional. A structural leg length difference is when one leg is actually shorter than the other. That's when the bone is shorter. That could be through something like surgery. So let's say to do knee surgery, hip surgery, that could make things out of balance. Most times surgeons, I believe, they try and correct any leg length differences so it's equal between each side, but sometimes that doesn't happen, so surgery can create a leg length difference. You can also have a leg length difference from a fracture as a child. So for example, if you fractured your femur or any other bones in your leg, that could prevent any development in that specific leg, and it might not develop as long as the other leg, which can create that leg length difference. Sometimes it can just be genetics. Sometimes one leg tends to be shorter than the other, and sometimes we don't know where it comes from, but generally those are why a leg length difference can happen. A functional leg length difference is when one leg appears shorter than the other. There are certain things can pull the hips out so that they're not in alignment. So that could be muscle imbalances. So muscle imbalance, there's tighter on one side or it's weaker on one side, and the hips could shift slightly so that to compensate for it, and your legs appear shorter. It can also happen if one foot is collapsing more than the other, or the one foot is a little bit higher, so rolling out. So when that happens, let's say one rolls out, one rolls in, that can create a difference in leg length. So higher arch creates a bit of a longer leg, and a lower arch creates a bit of a shorter leg. So it can appear short on that collapsed foot. To correct a functional leg length difference, there are certain things like physiotherapy, chiropractor that can help realign those imbalances, or orthotics to help correct the feet so it will give you a bit of a straighter leg, and so that your legs are a little bit more even on each side. To correct a structural leg length difference, that is when a heel lift is needed to lift up the short leg to make it in line with the longer leg. Heel lift is not necessary in a functional difference because there are other things going on and you want to address the cause of it. So back to the structural leg length difference, when you're putting a heel lift in the shoe or on the shoe, putting it in or on the shoe depends on how big the lift is and what shoes you are using. A lift that goes inside the shoe will look something like these. So there's the shorter ones that just lifts up the heel, and these go, actually both of these go underneath the insole. So you take the original insole out of the shoe, you place this right at the back of the shoe, just like that. So it stays at the back of the shoe. You don't want it any far forward, just push it right to the back of the heel, and then you can put your insole on top of it, and then that prevents the heel lift from sliding when you're trying to put your foot in. The longer one works in this exact same way. You take the insole out and you put the lift inside the shoe and make sure it's at the very back. Now, the difference between these two is that the longer one will give you less of a heel lift. So when you're lifting up the heel, that might shorten the calf a little bit because your calf isn't in it's in a less stretched position. So a lot of people like this kind of lift because it lifts up the whole foot instead. And also when you lift up the whole foot, that might give you a better balance between each leg. So if you're lifting up the whole foot, then when you're pushing off, or if you're on the ball of your foot, then it can give you that balance between each leg a little bit better. These types of lifts are great to put in shoes that have a removable insert, that are a little bit deeper at the heel so that you can accommodate it just enough so that your heel isn't sliding out of the back. Dress shoes, for example, tend to have a little bit less at the heel. In that case, there might not be enough room for your heel to stay inside, and the back part of the shoe won't be able to grip the heel, so your heel starts to slide out. The other case is when your lift ends up being a little bit larger. Typically, if it's about 6 millimeters or 1/4 of an inch, usually that's okay. You can put it inside the shoe. Some people can even put more inside of it, but some can put less. But that's generally what I find, is that the 6 millimeters or the 1/4 of an inch fits inside of a shoe. And if you're going any larger than that, you have to put it on the outside of the shoe. When you have to put the lift on the outside of the shoe, it then tends to be a little less convenient because you can't just take your lift out and then put it into all of your shoes. In this case, it's permanent on your one shoe, and you have to wear that shoe to get the lift, or you have to put that lift on all of your shoes. So in a shoe like this, for example, these types of shoes are better for a lift on the outside because they have a thicker sole and it's easier to cut through, and we can put a lift on it a lot easier. So what we do is cut through this sole, add material, and then put the sole back on. So here is a shoe that I've cut through. So we have the bottom piece and the top piece. So this piece is where that material will be added on to create that lift. Once that material is added, this will be glued back on, and it will give you a lift on the one side of the shoe. I do want to point out that sometimes there can be both a structural difference and a functional difference present. So in that case, you do want to address the structural difference, but you also want to deal with the functional difference. So if you have a structural difference, so one leg is actually shorter than the other, and you've had that for a long time, you've never dealt with it, sometimes the body can compensate into a bit of a functional difference on the other side. So in that case, you might not be able to put the full lift in. So let's say you do an x-ray or some sort of imaging, and you find out that your right leg is a centimeter shorter than your left leg. So you don't want to put a full centimeter onto your right leg, because your body may have compensated, and now you put that full centimeter lift on the right side. All of a sudden, it feels a lot higher, and you're actually a lot higher because on that right side, because there have been compensations and the leg doesn't appear to be the full centimeter short on the right side. So in that case, you put less lift on the right side, you do your physiotherapy, chiropractor, or whatever you need to do to address that functional difference. And then as you start to get away from those imbalances, you might need to add on to that lift. The other way can be true. Sometimes you need to add more lift and then take away, depending on how your physiotherapy, chiropractic treatments are going, and make sure that your hips stay level as you rehabilitate your muscles. I hope that gave you a little more better understanding about leg length differences. And if you do have any questions, feel free to reach out and I would be happy to help.